Hey there, I'm Maddie Gardner at the WBTV News Now desk. We are in the second or third day of February now. It is February 3rd, and February is also American Heart Month. We talk a lot about heart disease, right? Because it is the leading cause of death in America. And there are a lot of misconceptions out there, especially recently when it comes to exercise and your heart health. How much is too much? Is it safe for me to exercise if I have heart disease? So I went to a cardiologist with Novant Health, Dr. Akshay Pindial. We had a really great conversation about exercise, about heart health, and how to protect yourself. So I'm going to play our full conversation for you now. I'm with Dr. Akshay Pindial. He is a cardiologist with Novant Health's Heart and Vascular Institute. Dr. Pindial, it is Heart Month. We are learning more about heart health. But recently, Hollywood has connected exercise to some traumatic heart events, heart attacks, and death. Is that the case? Should we be worried about exercising?
Yeah, it's unfortunate that Hollywood sometimes includes these dramatic stories of exercise being linked to fatal heart events, because by and large, exercise, and by exercise, I mean regular aerobic exercise, is one of the best things we can do to keep our heart healthy and strong.
So are there any precautions we need to take when we're working out so we don't stress our hearts out too much?
It's a great question. I mean, first and foremost, I would say talk to your doctor before you start a regular exercise program to make sure your heart is healthy enough. But I also tell patients, especially those who aren't accustomed to exercising regularly, start low and slow. Walking is great exercise. 20 minutes of walking at a decent pace, 4 to 5 times a week, is a great place to start.
So you do encourage people to exercise, even if it is low intensity. And how does that help our heart and vascular system?
Yes, I definitely encourage it. And that's one thing that I hope your viewers will take away from this interview. Don't try and get scared away by what you see on TV or in Hollywood. Exercise helps the heart and the cardiovascular system in a lot of different ways. It can lower your heart rate, lower your blood pressure, improve your body's ability to process things like sugars and cholesterol. And there's even, I think, long-term benefits with regards to reducing inflammation. So exercise helps the body in a number of different ways.
As we enter Heart Health Month and heart attacks, heart disease being a big killer in the United States, what are some ways that we can prevent those traumatic events from happening, aside from getting on a Peloton bike, which we have debunked now in this interview?
That's right. That's right. We talked about exercise already, but you've heard the old adage, I'm sure, that, bodies are made in the kitchen. And so really nutrition and a healthy diet is the cornerstone of keeping your heart healthy in the long term. If you think about your dinner plate, what I always tell people is I want 2/3 of that dinner plate to consist of things like fruits, vegetables, and whole grains. That remaining 1/3, if you're going to eat protein, I want it to be lean protein, turkey, chicken, or fish. Baked, not fried. Use olive oil for cooking. Those are some standard ways that I think everyone can improve their heart health. That was Dr. Akshay Pindial with Novant Health. Some good information there. I think mixed messages can be so confusing, and we want to put our heart health first. So we appreciate his time and that information. I'm going to leave you with a look at the future cast right now, because it is a first alert weather day with that rain moving in across our area. And I'll also give you a live look at our HD tower camera. But I do have to warn you, it looks very cloudy today, and you'll see what I mean in just one moment. Take a look at that. Goodness. We will have full updates for you on WBTV.com/weather.